Hello, everyone, and welcome to the Brownstone. I'm your host, Dr. Michelle, and you're listening to Numbers Don't Lie. We learn to get out your feelings so you can make the best decisions for yourself, your family, and your business. Well, welcome back. We have a special episode. I feel like that about every single guest because everyone is so different and they bring so much expertise and their different perspectives to the table. But I've never had, let me never say never. I don't think I've had a physician. I've had a surgeon, but I have not had a physician up here. So this is exciting to be able to get the perspective of those people that you see regularly. If you're going to the doctor regularly, which you should be at least once a year, okay, you should be able to get talk to someone like her. And if you haven't been going to the doctor, definitely tune in. And if you're an entrepreneur or a physician yourself, this is definitely going to be a treat for you because she's an entrepreneur slash physician, so I love that combination because I don't feel like enough professionals have that perspective, even when they go into business for themselves. So it's just like you need both. You got to be able to run do the skill well, but also run a business well. So we're going to hear more from that perspective today. So I met Dr. Ronya, I think through a mutual friend through a business group, and she just fit right on in. So without further ado, please welcome to the Numbers Don't Lie stage, Dr. Ronya Green.
Hey, Dr. Michelle, thanks so much for having me today. I appreciate it.
Thanks for saying yes. Look at that branded collar shirt you got on.
She
Yes.
printed it.
Oh, shout out to She Prints It. I
Yeah.
love it. So we're gonna get to care nexus soon so everyone can see the mystery around what that is. But before we get too far, could you please introduce yourself
Yes.
formally?
Yes. Well, I'm Dr. Ronya Green, board certified family medicine physician. I currently serve in the Middle Tennessee area, but I'm licensed in Texas and Georgia as well. So I have patients in those states also. And I just have a personal commitment to improving access to care. So that is for the disenfranchised, but also for those of us that avoid seeking care for different reasons. And so I'm on a mission to improve access to our community by any means necessary.
I love it. I love it. Awesome. So let's dive into it. So you've built this membership model, and I actually talk to people about it all the time, honestly.
Oh, great,
I'm
great,
like,
great.
yeah, I know a doctor, because I do work in the health insurance industry, and health insurance landscape is just changing. I don't know for those listeners that are tuning in, it's just different, especially after that whole fiasco last year with the CEO being shot. It's just different, and people starting to view care differently. And I do think the model that you have, like this membership model, that's it's funny because it's like innovative, but it's not because this is how like healthcare started, where it's just like you have the neighborhood doctor and everybody went to the doctor, or the doctor came to their house before health insurance took over. But I do think the model that you have is definitely coming back in style. So could you tell us what made you choose this membership model for primary care, and how the patient experience with that been?
Yeah, well, you've got it. You have absolutely got it. It is how medicine started. And I like to say that the doctor patient relationship is back. So I fell in love with the specialty of family medicine during medical school. I loved this idea that I would be able to walk with my patients through different journeys in life. No matter where they were. So I worked with two amazing women physicians. We'd start the day at the hospital doing some rounds there, and then we'd go to the office, seeing families. Like people would come in literally multi-generational, the grandmother, the mom, and the daughter. And I just love that. There is no greater reward or compliment for me as to when someone brings me their family member to take care of. But, we saw these patients, at a nursing facility in their homes. And I loved that concept of just growing and walking with people through life's transitions. And that's why I went into family medicine. And I've enjoyed a career that's spawned over 12 years in the graduate medical education space, in the hospital administration space, and even now in the healthcare policy space. But for why I went into medicine, it is really that relationship with my patients. And so the membership based model just makes that so much easier and it's so much more clear for both the patient and myself. It really takes away barriers when we think about paperwork and processing information and prior authorizations and looking for certain covered benefits and certain, facilities or other providers that are in network or in contract. When all of that is removed, we're back to the doctor-patient relationship. And that is why I went into medicine in the first place. And so I'm just really, really grateful that at this point in my career to be able to experience my clinical practice in that way. And so you're right, membership-based medicine is growing, and there's lots of different names for it, right? So there's concierge practices, membership-based, direct patient care, direct primary care, and all different specialties are going into it. I have dermatologists, neurologists, colleagues, who have made this their choice as well. And so all of us are really just craving that time back with our patients and the simplicity in the practice of medicine.
Nice. And for those of you that may not understand because I know you just broke down a whole bunch of terms, could you just say it simply like, what is that membership model? What does that
Mm-hmm.
mean for the patient?
Yes, absolutely. So you pay a flat contracted rate for unlimited access to me as your physician. And in my practice, not in every practice, but in my practice, that also includes all of your labs or blood work. So blood work, if we do any like pathology, think of like a pap smear, cervical cancer screening, that has an element of pathology there. Any sort of urine test. So any sort of lab work that we do is also covered in that. And that's it. There, you don't ever get a bill from my practice 6 weeks later saying, oh, remember when we did this? Here's the rest of the payment that's due. But you pay your membership fee. We deduct it monthly or annually if you want to get a little bit of a percentage off. But that's it. So it's very expected. This is what I'm paying for my healthcare. And so that's what we mean by membership-based model is patients have access to me through that membership payment style.
Very nice. Because I when you said that you don't get a bill later, let me tell
Yeah.
you, I went to the ER and I was like, I paid a bill. I feel like I paid a bill. Did I pay a bill there? I don't know. Because I have an HSA. I just swiped the card. And then I
Mm-hmm.
think I paid a bill. And then someone came later. I was like, I don't understand. I had to call. Now, I worked for a health insurance company and I was confused. So I
Yes.
always think about the average consumer. I'm like, if I'm confused on why I have two different bills, because like, oh, one's for the facility, one's for the doctor. Why y'all couldn't wrap that up? And one
Listen,
time,
Dr. Michele, I'm a physician and I'm confused. So I have to, like when I've been in those situations, whether it's me providing care or accessing care for a family member, I have had to call. So it is super, super confusing and difficult to navigate. It's just one of those things. But yes, but you also brought up another good point, health savings accounts. So members can use their health savings accounts to pay their membership fees for direct patient care. And there's active like legislation from DPC alliances to get that amount even increased as to how
nice.
much that individuals can pay. So yeah, you can use your tax benefit from your employer for direct patient care.
Nice. If y'all don't have an HSA like you can actually get it, I highly
Yes.
recommend you go ahead and take advantage of that. I appreciate to all my team members. I'm like, listen, that thing is a lifesaver. And like I said, it's a tax-free benefit.
Right.
You better snatch it. You don't get too many benefits like that.
Right. Right. But and now it comes with the choice. And that's what I love
Mhm.
educating people about. Now you can actually choose. Because I get that question a lot. If I have insurance, will you still be my doctor? I will be. I just don't bill your insurance. So, but you can certainly use your health savings account benefits.
Awesome. Okay. So when you were first starting Rocka Healthcare, that's the name of her business, guys.
Yeah.
Okay, so what data, like when you go into your own, it's like you no longer under like this big
Mhm.
machine, and they do the health electronic health records and all that. Like, what does data look like for you now on your own?
Ooh, that's a great question. It actually doesn't look that well. It's actually more complex from the perspective
Really?
of the business owner. It is. It is. So data points in I guess initially when I was thinking about launching my practice and what that looked like, I needed to look at, who else was serving members in this way in the communities that I would be serving, how many available folks are there out there, how many people may not have insurance, maybe people that fall within the gap, right? Now, a very interesting data point that happened for me as Rafa was launching and in our first year is that I noticed that the majority of my patients were business owners. They were entrepreneurs
Hmm.
themselves, or they had small teams. So I said, wait a minute, let me actually look at the numbers of this. And it was 85% of my patient population.
Wow.
And so I said, well, I'm serving a need here. And so being a little bit of a data geek myself, I think that's why the two of us align so well. I said, let me ask them, let me get further data points as to why this serves them. And so I
Hmm.
actually surveyed my existing patients and I said, why do you love Rafa? Why do you continue to work with me? And the answer was, hey, I'm busy. I like the direct access. I appreciate that I can text you, email you. I appreciate that I'm not waiting, 2 weeks for an appointment to be seen. I need an answer now. I don't have a lot of time to go back and forth. And so then that, from the business perspective, helps me lean in my marketing strategy and said, hey, this is my avatar. This is the group that aligns with my practice. At least right now, that's what it is. And so that's how I use data to kind of help refine my marketing strategy.
That's awesome because I actually had it as a question up here, but I took it off. I was like, I think it's going to actually come up naturally, and it did because that wasn't just for physicians and doctors that go into business. That's for any entrepreneur to be able to take a look at who are your clients, who are you serving, because whether you know it or not, a lot of times there is a pattern there. It's usually not sporadic. You know what I mean?
Mhm.
It's not random or by chance. And so I love that you just did a simple tool like survey them and got the answers and then use it in your marketing. So
Yeah.
kudos to you for taking action. And I think she did it before she knew me, y'all.
Yeah.
So you know what I'm saying? So she's already been the bomb before Dr. Michelle came on the scene. So I love that. Did you know that data driven organizations were 19 times more profitable? 19. You heard me right. Perhaps you're asking, what is data driven and how do I become one of those organizations? I'm so glad you asked. I want you to go take a quiz. It's a simple, quick quiz to help you assess if you are, in fact, one of those organizations. Head over to mogulbeginnings.com/data into dollars quiz now. That's mogulbeginnings.com. You can just go to mogulbeginnings.com and it'll show you the data into dollars quiz. Take it now. You'll see if you're on your way to 19xing your profitability. You're listening to Numbers Don't Lie on KCCR Cityscape. We hope you're enjoying the tunes and all the jams. Make sure you visit our website over at brownstoneworldwide.com to learn about all things Brownstone. You can check out Brownstone Living Magazine and all the great things that we have on the website, as well as the shop. You just got to head over to the website, brownstoneworldwide.com.
Keeping it locked to KCCR Radio,
my station,
the Brownstone Center. And don't forget, no matter where you go, there we are.
So what about from the perspective of like the health side? Like but has that become more complex?
Health data that I'm tracking.
Mm-hmm.
Um, Not exactly. So I mean, this, like being in the insurance space, there are value-based programs where they're looking at different quality metrics and they're actually grading on how physicians get paid in that way. Obviously,
Mm-hmm.
we don't have that in a membership-based practice. But it is important to still look at my patients' um, data, and how those quality metrics, if you will. So for me, an example is someone who has diabetes and tracking their hemoglobin A1C. And so making sure that my EMR is equipped with data tools where I can kind of plot that graph out. I love being able to show patients that. and say, this is what it was last time. This is what we're working to. This is where our goal is, and how we're moving along that access. So, I think it's about, on the health side, I think it's about speaking to the data points that matter to patients, right? That's the other
Absolutely.
part of it. Same thing, people don't necessarily have a concern about like what my microalbumin ratio is. People even give me a
We
look
don't
at
know what
the
it
thing,
is.
right? Like, what is that? But people do have a concern about like, what is my risk for dialysis, right?
Mm-hmm.
So making sure that I can translate the data tools that are important to me, the data points that are important to me, into what matters in terms of patient outcomes.
I love that because I do feel like in the larger health systems, especially like if you go to, it's a clinic, but it's a part of a larger health system, they do have portals, but it's just all there. And I'm like, I don't know what this means. Like, what is, like I said, what is albumin? And it's so much. And it's just like, I love that you translate it because a lot of times it's just there. And it's just like, it's up to the patient to, I guess, Google what things
Mhm.
are, or we have to wait for another conversation with our healthcare provider. So it's just like, it's a lot of touch points just to get to a basic answer, if that makes any sense.
Yeah. Yeah.
So I love that you do that. Okay, I like this one. Um, Satisfaction. Like, how do you handle, are you tracking customer satisfaction? Like make sure they feel seen and heard. Like, how does that look for you now?
So in various ways. So now, a big shift for me going from an employed physician to an independent physician, is again like the marketing, making sure that you're getting reviews so that you're building, your know, like, and trust in the community.
Mhm.
So some of that is, through reviews. And then just check-ins. I mean, I'm not afraid to ask, individuals, is there something more that they need? I have been very, very fortunate to have very low churn in my practice. So I think we're providing high value to keep patients satisfied. But patients that do leave, again, we have an exit survey. To tell us, it's usually a conversation. I've had a patient who needed to leave because they needed to get on commercial insurance for an elective surgery, things like that, that I had needed to help them. I helped them navigate that part of it. Um,
Nice.
but we do an exit survey because we want to know, are there opportunities for us to improve, or is it a change in, something that happened with the patient? Are they moving? Um,
Hmm.
so we like to collect those data points and look at opportunities to kind of keep in touch with patients to see if we need to pivot in any way.
I love that. I think that's a simple thing too. Like everything you mentioned is very manageable and doable. Like you're not doing anything that's like so high level that no other business owner can do it. So it sounds like, we don't have an excuse.
Yeah. 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 I mean, I think, time, right? And
Mhm.
so we've done our best to build in automation tools to help with that, because I think that's the thing, is that people just feel like, oh, I was gonna do that thing and then I never got around to it, and now
Mhm.
concerned that it's too late. But building in the time to and getting out of some automations to help us with time, I think is important.
Awesome. And so you mentioned about how you, I guess, save your electronic medical records, like the labs and things like that. So I guess that's a good time to pivot us into Care Nexus.
Mhm.
Um, what were the pain points? Like, what made you even like think to create something like this?
Oh, yes. So it was certainly pain points. Your girl was not looking to be a health tech uh, developer, creator, marketer, none of those things I set out to do. But here we are. My pain points were, it was like I had traded when I was an employed physician, I was going from room to room to room to room, 15-minute appointments, very rushed, not feeling like I had enough time with my patients. And that was frustrating. And
Mhm.
now I was in this space where I had this time with my patients. I could really talk to them about what was going on. We weren't rushed in our interactions, and it was great. But I had some serious administrative burden. And it was because I was, documenting in one place and then having to transition to the EMR when they actually became my patient. And then I had, my Calendly for booking. And then I had this other software that was helping me manage payment processing. I had no less than 6 different tools in my
My
tech stack.
goodness.
And it was ridiculous. I had
Mhm.
another secure texting service that was utilized for my clinic phone. It was just too much, and it was expensive.
Yeah.
The time that I was using there, I was like, wow, I did not pivot in this way in my practice for me to have this level of administrative burden. And so I started out looking for a solution because, again, like, yes, we're a small number of independent practices, but we're mighty. So I'm like, there has to be something out there for us. And it wasn't, Dr. Michelle. It wasn't.
Wow.
Um, Let me tell you, I learned the term API and I started asking everybody for one. I was like on the phone, sending emails. Do you have an open API that would work with this? Do you have an open API that would work with that? And I kept getting no, 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 no. And I said, I think I might have to do this on my own. And so I
Wow.
started talking to developers and folks in the tech space that are way more savvy than myself, and started explaining what I needed. And they said, "Yeah, we could do that. Yeah, we can." And so then I was like, "Oh, this could actually be real, and I could, share this with other people because I hear the same thing from other docs that have independent practices. Like, we're finding a tool to do this, a tool to do that, a tool to do this, and it's frustrating. And so that is how Care Nexus was born. Nexus, the most important or central part of providing care. So it's the heartbeat of the practice. And it is a solution that helps you manage relationships with potential patients and clients before they enter the practice. You do not have, it's in a HIPAA compliant space. That is also the space where you'll document all of your electronic medical records about that patient. It'll receive your labs. It is a connected phone service, so you can text, you can make calls, web-based calls.
Nice.
They can call you, um, and you can accept payments. And so it just remove the barrier to so many things. The self-scheduling piece, because that's the other thing, Dr. Michelle, is that practices such as mine are typically smaller because we want more time with our patients, right? And you
Mhm.
can't have this um, time, exchange if you have a larger patient volume. And
Right.
so with that time, we need other tools in place to help us manage our practice. So things like,
Mhm.
if you're my patient, you can go in and say, here's Dr. Green's schedule. Let me put myself on her schedule for May 27th at 12. That works for you. That works for me. It's locked in. We're there. You can choose, is the patient in person or via telehealth? And then you're going to get reminders leading up to that. And so Care Nexus has really been the gift in, for me, a small practice having very large practice tools,
Mhm.
and making my patients feel like, they have access to everything they need, including their physician.
I love it. That's the dilemma of many entrepreneurs having them.
Mhm.
Girl, I got charged for something. I forgot that I had a membership, and I was like, "Oh, see, this got to
Yeah.
go." Like, But I love that you're able to condense, like I said, saving time, saving money. It's so much like you got to make things talk to each other.
Mhm.
I'm so happy that you took the initiative to do that because most people would have stuck to what they were doing and try to make it work or, just complain about it. But I like that you took this problem and you were the solution. So kudos to you, Dr. Ronya.
Yeah, thank you. Thank you. This entrepreneur life, it's an interesting one and it takes you some interesting places, but I'm grateful for the journey. I have truly met just amazing individuals, such as yourself, and the opportunity to talk to folks and like, what about this and what about that?
Mhm.
And giving me the ability to kind of validate some of my thinking, because I'm a physician first. And so I think it's important for us to bring folks to the table that have insight that we don't, and tools that we don't have, and share them all together to get where we're trying to go.
I think that segues us towards the end because if you were talking to a fellow doctor that was interested in starting their own practice, what's one piece of advice that you would give them that would help them create something that's sustainable?
Uh, I mean, first I'm gonna say just do it. Like if it's a vision that you see, step out there and do it. Don't talk yourself out of it. I think very honestly, for physicians, there are a number of things that we can do. And so it's very easy for us to talk ourselves out of the thing that may seem a little bit more daunting,
Mhm.
because we're worried about, will we have all the answers? Will we have everything that we need? And so yes, you will have everything you need. Specifically about transitioning to an independent or direct patient care practice, I've actually created a resource for that, a checklist that I'm happy to share with your viewers, and we can send out a QR code or put a link in the show comments so that they can download that resource. And it is very practical, 3 pages of all of the things that you need to think about from a legal and financial standpoint when getting ready to do this. So the first thing is the mindset shift. You can do it. Do it even if you're afraid. And then the second is, get the checklist and start your work.
Awesome. You are really great with this segue because I was going to ask how the listeners can connect with you. You've already told them a resource that they can grab. So, how else can listeners connect with you?
Yeah, you can follow me on LinkedIn. You can follow me on Instagram at Rafa Healthcare DPC. Would love to see you there.
Awesome. This was so good. So many nuggets because I don't know, like, I feel like entrepreneurs, we are naturally innovative, and you already told, like, even you just transitioning your skill to, like, okay, I'm do this, but you literally created something new. So I think we as entrepreneurs, we forget that we're naturally innovative because we're trying to be a solution. But I love that you actually painted that full picture. This is a problem, I addressed it, and this is a wonderful solution. So if all you that are out there have your own practice and you have those same struggles,
Mhm.
definitely connect with Dr. Ronya. As somebody that likes tech, data and tech myself, I promise you, when you're trying to quantify your impact and really gauge client satisfaction or anything like that, you have to have the right tool stack, tech stack. Like, and it's great if it already talks to each other so you can kind of match people up. It makes it easier on people like
Yeah.
me.
Yes.
So,
Yes.
so definitely connect with Dr. Rania and ask about Care Nexus. And then thank you guys for tuning in to another episode of Numbers Don't Lie with Dr. Michelle here on the Brownstone. I appreciate you guys. I appreciate your ears. I hope you learned something new. You can follow me on all social media at Mogul Beginnings. That's MOGUL, Mogul Beginnings. Say, hey, I'm a real person. I will respond back. Have some resources as well that's in the show notes. So I hope to hear from you and connect with you soon. And then make sure you head on over to the Brownstone. So brownstoneworldwide.com. That's where this show is being hosted, or all things Brownstone, and check out their store and their posts and the news and all that great stuff in the magazine. I have articles in there as well. So tons of things to keep you informed on what's going on as just a community member, but also it's very heavily focused on entrepreneurship. Okay, I think I'm done. Thank you guys for tuning in. Thank you so much, Dr. Rania.
Thank you,
And I
Dr.
hope you guys,
Michelle.
yeah, and I hope you guys have a great rest of your day.
All right.
See ya.
Thank you.
Mogul Beginnings Data Consulting helps nonprofits and small businesses strategize, optimize, and scale by unleashing the power of their data. So if you're ready for your data to be unleashed to help your business tell beautiful stories, connect today by logging on to mogulbeginnings.com. That's mogulbeginnings.com.